back for one last time, at least just during this session today. You know, one of the things I wanted to remark is that, you know, the legislation that's before all of us today that we've been voting on, that yes, this is legislation that's been advanced by women legislators in our chamber, but I wanted to be very clear that the responsibility of reproductive and maternal health care does not solely fall upon the shoulders of women legislators. It is our collective responsibility in this regard. And so again, I want to thank the Senate Majority Leader for not only recognizing this, but also for bringing this important package of legislation to the floor. And so with this particular bill, it will allow for a comprehensive and holistic approach to address the maternal and infant mortality crisis by directing the Department of Health, the Commissioner, to convene a work group of stakeholders to holistically review maternal health and birthing standards. So when you hear statistics such as 3 times as likely to die, hundreds of thousands of people or children being born with low birth rates, what does that mean? How do we begin to wrap our arms around what's happening in our state? In a state with as many resources as we have, we can and should be improving maternal health outcomes, and that's why this work is critical. This work group will be looking at not only the data, but also trying to examine best practices, recommendations that can truly help to improve birth outcomes and reproductive care for all New Yorkers. And so Governor Hochul recently announced a new proposal to address components of the maternal and infant mortality crisis, including access to care, maternal mental health, and the unnecessary use of C-sections in the birthing process. This even goes up to the federal level because the Biden administration in June of 2022 released the blueprint for addressing the maternal health crisis, which drew attention to the increased need for women to be supported as active participants in their care throughout and after pregnancy, and as reflected in the Momnibus federal legislative package co-sponsored by the Congressional Black Maternal Health Caucus. So with that being said, this legislation takes into account all of those conversations and legislative proposals, and now from our respective chambers, we are taking it to the next stages. And so again, this work group complements all of these things and will ensure a comprehensive and thoughtful review of maternal care to ensure that birthing people in New York are receiving the highest standards of care. Thank you, Mr. President. I proudly vote aye.